healthcare, and that's to make money. Let me remind you that money comes from all of us. The UCP is taking public money, our money, and handing it over to private interests. They're putting profits ahead of patients, and we cannot let that happen. The UCP will tell you they are modernizing the system. Friends, it's a lie. They're talking about failed schemes. The UCP is telling us that privatization costs less. Again, this is a lie. It has always cost us more. They're telling us privatization is more efficient. You hear a trend here, friends? A lie. Privatization sacrifices patient care by cutting corners just to increase profit. The UCP tells you privatization increases access. Again, these are lies. They reduce our access. If anybody has stood in line and watched others pay to go in front, it didn't shorten my line. Friends, I represent 29,000 frontline healthcare workers here in this beautiful province of Alberta. Paramedics, lab workers, and every therapist you can imagine. Our dedicated and highly trained works both in the public and the private sector. We are the experts in healthcare and how this system operates, and we know the system impacts on patient care. Our members working for private employers tell us that their ability to care for patients is compromised as corners are cut, services are reduced, and staffing levels are limited just to increase profits. Their wellness is never taken into consideration, and their financial futures are uncertain as their pensions are at risk. Friends, all a healthcare worker ever wants is to be there when patients need them. After privatization limits that access, our labs are being privatized right now. Our members are transition talks with Alberta to move from public labs to private for-profit labs. And it's not like it's the first time we're going through this again. It's been tried before in Alberta and it failed. Wait times for test results increased as the private operators failed to meet the obligations. And eventually, it was the public sector that had to step in and take over. Here we go again. The UCP is contracting out more surgeries in this province, spending hundreds of millions of dollars to do it. Why? Their own reports show the capacity already exists in our public healthcare system to do more surgeries. But it doesn't matter to the UCP. All they care about is moving public money into private hands as fast as possible. And they choose to remove anyone who stands in their way. For years, HSAA has been sounding the alarm about the crisis in the paramedic system in Alberta. When the UCP says an ambulance will be there when you need one, folks, I am a paramedic, and I will tell you right now, it hurts me to say it, it's a lie too. Friends, you know what I've been saying when I say a red alert means there are no ambulances in the province. They now measure in the thousands in Edmonton and Calgary every single year. They don't even track rural community code reds anymore. We do, and they're happening every single day. Privatization's not going to fix this crisis. People will. If the UCP isn't interested in taking care of the people already caring for Albertans, they just want to write checks to the private companies. Here's the hard truth, friends. Private companies don't have access to a storage room full of trained paramedics or lab techs. They can't just pluck them out of thin air and plug them into somewhere. We need to be doing more to retain the people who are sacrificing their well-being for us. We need to be helping them become more resilient. Instead, this government is forcing them to work for employers who don't look after their well-being, whose financial security because it just costs too much money. They're trying to force pay cuts on the very healthcare workers who are the hardest to find right now. Friends, we have professions with a 200% increase in vacancy rates. There's none left to have. They're already eliminating workplace health, wellness, and safety measures, further damaging our capability to respond. There is one thing that you can do to make this UCP government change course. It's you. You have to get louder. You have to demand it. We will do this fight together. You have to make it clear that their political futures face dire consequences if they continue to put profits over patients. We need to make it clear that you need people to care for people in this healthcare system. What all healthcare workers want to do is to be there when you need them. Help us. Let's all continue to raise this alarm. Send a message to this current government. Not destroy it. People over profits. Solidarity, friends. Thank you.